The word investment is important, not just domestic financing, but recognizing that we need the mindset to change, that governments really view health as an investment and not a cost.
Governments need to dedicate at least 6% to healthcare financing. They also need to reduce out-of-pocket payments to less than 20%. And they need to make sure that whatever funds they allocate to healthcare, at least a third of that is at the primary level, primary healthcare. The declaration states that for $1 invested in primary healthcare for non-communicable diseases, you get a $7 return on your investment. We need to show that to ministers of health and ministers of finance. And after we show them how to translate the commitments into fiscal arguments, we need to bring ministers of finance and ministers of health together, create a space where they can have workshops, roadshows.
The number one solution for financing NCDs is health taxes. It's a triple win. It generates revenue for governments, it reduces the burden on healthcare systems, and it saves lives. 50 million lives in 50 years if all we do is increase the price of tobacco, sugary beverages, or alcohol by just 50%. I think what's most exciting for me around health taxes is not forgetting the public health benefit, because this is a solution that will continue to have dividends over time. We also have an opportunity to engage the public in dialogue about why this is a good solution, how they can engage in healthier behaviors. Information is power, and when you don't know the harmful impacts of what you are consuming, you actually don't have choice.
What we've learned also today, it's really about multisectoral coalitions, and I believe that is the role that private companies can play in these. It's really about getting away from just pure donorship to really co-creation, collaboration, the co-architects resilient healthcare systems. I think that's the role that industry can play. We really need to align all acting partners on shared objectives and priorities.
There's so much misinformation and mistrust right now. And so I feel like we have a lot to learn even from low-income countries, low and middle-income countries who have had such success in implementation and public buy-in of the help they're receiving and how then they can play a part in their communities. We'll continue our clinical and scientific research on all these things, but new ways to talk about NCDs and mental health so that the public understands and wants to be involved is going to be very important.
The UHC theme for this year has been health, it's on the government. But again, knowing that it's partnerships that are important. It's been interesting too to see the shift in recognizing that as official development aid has waned, that there's a real emphasis now in looking at how do we do this differently? How do we have financing schemes that bring together partnerships, likely partnerships and maybe unlikely partnerships? How do we also fight the forces that are preventing us from overcoming some of the barriers? But we really have to be committed to the ultimate outcome.